I typically go through all options for erectile dysfunction. If you have failed previous treatments, such as medications, vacuum erection devices, or injections, or simply want to have a treatment that works for you every single time, then a penile prosthesis was most likely recommended. On the day of the procedure, you present to our outpatient surgery office and you are checked in, we put an IV in, the anesthesiologist meets you, and then you go back to the operating room suite where we perform the procedure. I perform the majority of my penile implants as an outpatient. You come to the hospital and are discharged on the same day. I ask most of my patients to go see their family physician, who may obtain several labs and an EKG so that we can make sure that you can have anesthesia in a safe environment. Since you will be receiving anesthesia on the day of the procedure, it is hospital policy that someone drive you home and stay with you for about 24 hours. The night prior to your procedure, we ask that you do not eat or drink after midnight. Your family doctor, cardiologist, or I may ask you to hold certain medications prior to the procedure. The most important medication is blood thinners. Aspirin or any other blood thinners that you may be on need to be held for a certain number of days, and we will give you specific instructions on that. Dietary restrictions prior to the procedure are very simple. Do not eat or drink anything after midnight. On the day of the procedure, we ask that you wear comfortable clothing. Everything else will be provided to you. If you typically do not shave yourself, we ask that on the day of the procedure, you do not shave, as this will be done for you before the procedure is performed. On the day of the procedure, you get to meet our nursing staff who will prep you for the procedure, as well as our anesthesiologist and myself. After the procedure has been completed, then we take you to a private room where you can recover, and after you're able to eat and drink something, we tend to send you home. Being nervous prior to any medical intervention is very normal. It's important to ask all of the questions that come to mind so that some of that anxiety can be remedied before we take you back for the procedure. My staff and I are always available to answer any and all of your questions before any procedure is performed.